Peanut allergy. Peanut allergy is one of the most well-known food allergies in the world, and one of the most dangerous. Despite the name, peanuts aren't actually nuts at all. They're legumes, in the same family as beans and lentils. But your immune system doesn't care about botanical classifications. For roughly 1 to 2% of people, the proteins in peanuts trigger a full-blown attack. Your immune system mistakes harmless peanut proteins for a deadly invader and unleashes a chemical storm. The reaction can range from mild itching and hives to anaphylaxis, a life-threatening reaction where your throat swells shut, your blood pressure crashes, and your body essentially shuts down within minutes. Even tiny amounts can trigger it. Trace contamination from a knife used on a peanut butter sandwich earlier in the day has caused fatal reactions. This is why "may contain peanuts" warnings exist on so many products. Once thought to be a lifelong sentence, recent research has changed the game. Early introduction of peanuts to babies, ironically, the opposite of what doctors recommended for decades, has been shown to dramatically reduce the development of peanut allergies. There are also new oral immunotherapy treatments that gradually expose patients to tiny, increasing doses of peanut protein to build tolerance. It's not a cure, but for the first time in history, peanut allergy isn't necessarily a permanent diagnosis. Tree nut allergy. Tree nuts are a completely different category from peanuts, even though they often get lumped together. We're talking almonds, cashews, walnuts, pecans, pistachios, hazelnuts, Brazil nuts, and macadamia nuts. About 1% of people have a tree nut allergy, and the reactions can be just as severe as peanut allergies, including anaphylaxis. Here's the tricky part. Being allergic to one tree nut doesn't mean you're allergic to all of them. Some people only react to cashews and pistachios, which are botanically related, while others can eat almonds without any issue but go into shock from walnuts. About 30 to 40% of people with a peanut allergy also have a tree nut allergy, which is why doctors often recommend avoiding all nuts to be safe. Tree nut allergens hide everywhere. Pesto contains pine nuts. Marzipan is made from almonds. Some Asian sauces contain ground cashews. Cross-contamination at bakeries and ice cream shops causes thousands of accidental exposures every year. For people with tree nut allergies, eating out is essentially a constant risk assessment exercise, where one wrong bite can be fatal. Milk allergy. Milk allergy is the most common food allergy in young children, affecting around 2 to 3% of infants. But here's where it gets confusing. Milk allergy is not the same as lactose intolerance. Lactose intolerance is a digestive issue where your body lacks the enzyme to break down milk sugar. A milk allergy is an immune system attack on milk proteins, specifically casein and whey. The reactions to milk allergy can include hives, vomiting, eczema flare-ups, breathing problems, and in severe cases, anaphylaxis. Symptoms typically appear within minutes to 2 hours after consuming milk. The good news is that most children outgrow milk allergy by the time they're 5, though about 20% will carry it into adulthood. Avoiding milk sounds simple until you realize how much hidden dairy is in processed foods. Bread, deli meats, canned tuna, salad dressings, and even some medications contain milk-derived ingredients. Words like casein, whey, lactalbumin, and ghee all signal milk presence. For someone with a true milk allergy, label reading becomes a full-time skill. Egg allergy. Egg allergy is the second most common food allergy in children. Around 2% of kids react to eggs, with most outgrowing it by adolescence. The allergens are mostly in the egg white, though some people react to the yolk too. Most reactions involve skin symptoms like hives and eczema, digestive upset, and respiratory issues, though anaphylaxis is also possible. Here's something fascinating. Many egg-allergic kids can eat eggs in baked form without reacting. The high heat of baking changes the structure of egg proteins enough that the immune system no longer recognizes them as threats. So a child who breaks out in hives from scrambled eggs might happily eat a muffin made with eggs. Doctors sometimes use this as part of a controlled treatment plan. Egg allergy used to be a major concern for vaccines, since some vaccines like flu shots are produced in eggs. Modern vaccines have been refined to contain such tiny amounts of egg protein that even severely allergic people can usually receive them safely. But always discuss with your doctor first. Shellfish allergy. Shellfish allergy is the most common food allergy in adults, affecting about 2% of the population. Unlike most childhood allergies, shellfish allergies typically develop in adulthood and tend to be lifelong. Only about 4% of people outgrow them. The category splits into two groups: crustaceans, shrimp, crab, lobster, crawfish, and mollusks, clams, oysters, scallops, mussels, squid, octopus. The main culprit is a protein called tropomyosin, which is found in muscle tissue. This is why shellfish reactions can be especially severe. Even the steam from cooking shellfish has been documented to trigger reactions in highly sensitive people. Restaurants that fry shellfish in shared oil can contaminate non-shellfish menu items, making seafood restaurants particularly hazardous for allergic diners. Interestingly, tropomyosin is also found in dust mites and cockroaches, which is why some people develop cross-reactivity. There have even been cases of people who could safely eat shrimp until repeated exposure to dust mites somehow triggered a shellfish allergy. The immune system is full of these strange biological surprises. Fish allergy. Fish allergy is separate from shellfish allergy. You can be allergic to one without being allergic to the other. The most common fish allergens come from salmon, tuna, halibut, and cod, but reactions can occur to virtually any fish species. About 0.4% of adults have fish allergies, and like shellfish, it tends to be lifelong. The main allergen is a protein called parvalbumin found in fish muscle. Unlike many other food proteins, parvalbumin is highly stable. Cooking, canning, and even processing don't break it down enough to prevent reactions. Even fish-based products like Worcestershire sauce, Caesar salad dressing, often contains anchovies, and some pet foods can trigger reactions. A surprising twist: some people with fish allergy can tolerate certain species, but not others. There's also a related condition called scombroid poisoning, which mimics a fish allergy but is actually caused by histamine buildup in improperly stored fish, particularly tuna, mackerel, and mahi-mahi. The symptoms look identical to an allergic reaction, but it's actually a form of food poisoning. Wheat allergy. Wheat allergy is the immune system reacting to one or more proteins found in wheat, and it's distinctly different from celiac disease and gluten intolerance, despite the constant confusion. Wheat allergy is an IgE-mediated immune reaction with classic allergy symptoms like hives, swelling, breathing issues, and anaphylaxis. Celiac disease is an autoimmune condition where gluten damages the small intestine over time. About 0.4% of children have wheat allergies, and most outgrow them by school age. Adult wheat allergy is rarer but can be severe. There's even a fascinating subtype called exercise-induced wheat allergy, where eating wheat is fine and exercising is fine, but doing both within a few hours of each other triggers a serious reaction. Scientists are still figuring out exactly why this happens. Wheat hides in unexpected places: soy sauce, beer, processed meats, salad dressings, and some candies. For people with wheat allergy specifically, not celiac, the focus is on avoiding wheat proteins, not all gluten, so they might be able to eat barley or rye, while a celiac patient absolutely cannot. The distinction matters when reading labels and ordering food. Soy allergy. Soy allergy affects about 0.4% of children and is most common in infants. About 70% of kids outgrow it by age 10. Symptoms range from mild, tingling mouth, hives, runny nose, to severe anaphylaxis, though severe reactions to soy are less common than with peanuts or shellfish. Soy is one of the most pervasive ingredients in modern food production. Soy lecithin is in chocolate. Soy oil is in countless processed foods. Soy protein is in veggie burgers, protein bars, baby formula, and meat substitutes. Even Asian cuisines lean heavily on soy through soy sauce, tofu, edamame, miso, and tempeh. The complicated part: highly refined soybean oil and soy lecithin contain such low levels of soy protein that most soy allergic people can tolerate them without issue. But fermented soy products like soy sauce and miso contain different protein structures that some people react to differently than fresh soy. Each person's tolerance threshold is unique, which is why personalized testing matters. Sesame allergy. Sesame allergy has been quietly rising for years, and in 2023, the United States officially added it to the list of major allergens that must be labeled on food packaging. About 0.2% of Americans have sesame allergy, and reactions can be severe, including anaphylaxis. The allergens are concentrated in the seeds and the oils pressed from them. Sesame is sneaky because it's often listed under names that don't immediately register: tahini, gomashio, halva, sesamol, and beni. It appears in hummus, hamburger buns, Asian dressings, energy bars, crackers, and bagels topped with seeds. Some pharmaceuticals even use sesame oil as a carrier for medications. Sesame allergy tends to be lifelong, though some children do outgrow it. The introduction of mandatory labeling has made grocery shopping significantly safer for sesame allergic individuals. But eating out remains a challenge, especially at Middle Eastern, Mediterranean, and Asian restaurants where sesame is a foundational ingredient. Pollen allergy. Hay fever. Pollen allergy, formerly called allergic rhinitis or hay fever, affects an estimated 400 million people worldwide. Despite the name, it has nothing to do with hay or fever. The term comes from 19th century farmers who noticed symptoms during haying season. What you're actually reacting to are microscopic grains of pollen released by trees, grasses, and weeds during their reproductive cycles. Different plants release pollen at different times of year, which is why some people only suffer in spring while others struggle through summer or fall. Tree pollens dominate spring: oak, birch, cedar, maple. Grass pollens peak in late spring and summer. Kentucky bluegrass, Bermuda grass, ryegrass, and ragweed and other weeds take over the fall. People can be allergic to one type, several types, or all of them. Symptoms include sneezing, runny nose, itchy eyes, congestion, postnasal drip, and fatigue. Climate change has been steadily extending pollen seasons by weeks compared to decades ago, and some studies show pollen counts themselves are increasing. For chronic sufferers, treatment ranges from over-the-counter antihistamines to prescription nasal sprays to allergy shots that gradually retrain the immune system over years. Dust mite allergy. Dust mites are microscopic creatures, about 1/4 of a millimeter long, that live in literally every home on Earth. They feed on the dead skin cells humans shed daily, and their preferred habitats are mattresses, pillows, carpets, and upholstered furniture. The average bed contains hundreds of thousands of dust mites, and most people are completely unaware. What people are actually allergic to isn't the mites themselves, it's their droppings. Dust mites produce microscopic fecal pellets that float in household air, and the proteins in those pellets are powerful allergens. Symptoms include year-round nasal congestion, sneezing, itchy eyes, and worsening asthma. Many people who think they have year-round colds actually have dust mite allergies. Reducing dust mite exposure is possible but not easy. Allergen-proof mattress and pillow encasements help. Washing bedding weekly in hot water above 130 degrees Fahrenheit kills mites. Lowering household humidity below 50% makes survival difficult for mites. Removing carpeting, especially in bedrooms, can dramatically reduce exposure. But complete elimination is essentially impossible. They're a permanent feature of indoor life. Pet dander allergy. About 10 to 20% of the global population has some form of pet allergy, with cats being twice as common as dogs. People often blame fur, but the actual culprit is dander, tiny flakes of dead skin, along with proteins in saliva, urine, and sweat. When pets groom themselves, they coat their fur in saliva proteins that then dry and flake off into the air. The cat allergen FeLD1 is particularly problematic. It's incredibly small and lightweight, allowing it to remain airborne for hours and stick to clothing, hair, and surfaces. This is why cat allergens have been found in homes that have never had cats. They hitchhike on visitors. Cat allergens can persist in homes for months or even years after a cat is no longer present. So-called hypoallergenic breeds are mostly marketing. While breeds like poodles or Sphinx cats may shed less, they still produce the allergenic proteins. There's no truly hypoallergenic pet. For severe sufferers, options include keeping pets out of bedrooms, frequent bathing of the animal, HEPA air filters, and immunotherapy. Some medications now specifically target FeLD1 production in cats, an exciting area of research. Mold allergy. Mold spores are microscopic fungal reproductive cells that float through indoor and outdoor air constantly. Outdoor molds like Alternaria and Cladosporium peak in late summer and fall, especially around piles of leaves and damp soil. Indoor molds like Aspergillus and Penicillium thrive in bathrooms, basements, kitchens, and anywhere with moisture problems. Mold allergy symptoms mimic other airborne allergies: sneezing, congestion, itchy eyes. But mold can also trigger asthma attacks, sinus infections, and in immunocompromised people, serious lung infections. Some types of mold produce mycotoxins that cause additional health issues beyond allergic reactions. The relationship between mold and your home environment is critical. A leaky roof, flooded basement, or poorly ventilated bathroom can become a mold breeding ground. Black mold, Stachybotrys, gets the most attention, but it's actually one of many problematic species. Fixing moisture problems, using dehumidifiers, and addressing water damage immediately are the best long-term strategies.